All right, welcome everybody to the Maine Rural Healthcare Education Grand Rounds. We are thrilled today to be inviting Tara Paradie of the University of New England. I'm going to just pull up some information about Tara here. So Tara is she's a physical therapist and the director of clinical education for the Doctor of Physical Therapy students at University of New England. She has a deep interest in promoting student self-sovereignty in learning. She's certified in positive psychology-based wellness and well-being coaching, nationally board certified as a health and wellness coach through the American Medical Association, and is a certified health simulation educator. She is a proponent of academic coaching for student resilience and success, and she currently serves as a member of the American Council of Academic Physical Therapy's Clinical Education Commission, and is the chair of the New England Consortium of Clinical Educators. I can't think of a better background to join the Maine Rural Healthcare Education Grand Rounds. To all of our new folks coming in, welcome. We'll invite you to leave your cameras off for right now. While Tara presents, she might invite you to turn them on if we have conversation. And when it comes time for the formal Q&A session, we'll definitely turn those cameras back on. So thank you, Tara, and the floor is yours. I will share the screen.
Terrific. Thank you so much. And David's doing me a big favor by sharing the screen because I was having a hard time putting my presentation up. So I do have a screen above me. You might see my eyes go up to the screen when I'm doing the presenting to make sure I've got some good notes. But I think that I can stay on top of things as we're progressing through in this way. So I'm delighted to be here today. And I'm coming today. That was a nice introduction. I know that I provided some of that information, but it really does speak a little bit to the vein of where I'm going to be giving this presentation. So we're going to start with looking at, I think you have this, the claim continuing education units for Maine Health. I'll interrupt myself and then go on. So please feel free to move through those pieces, texting that activity code. There you go. And that's in the chat.
Dropped in the chat. So I'll go ahead and keep pushing this through. It's all sort of the standard slides that we always present in these, but it's really, as long as you got that code in the chat, folks, you should be in good shape.
Terrific. All right, so we're going to jump to some learner objectives, but before we do that, I'm going to speak a little more, and hopefully you can engage in this presentation as not only a person who delivers clinical education to students in your rural settings or in any settings that you happen to be in, but also as a person who might consider being coached. Sometimes that makes it a little bit more interesting in order to see if you can make this personal to you. One of the reasons why I really love what I'm going to be speaking about, this master adaptive learner model, is because it gave me an umbrella to really work under with this framework in the work that I was doing with the students when we have to work on things like the affective domain. So typically when students, for us at least, are coming in, and I think this is true of other health professions as well, the places that they struggle oftentimes is their metacognitive thinking about their thinking, and also where they get caught up in that sense of not being able to maybe regulate emotions, panicking about where they're learning, or their own self-talk that is negative that interferes with that learning process. So the master adaptive learner model is for everyone. And that's what I think is so exciting about it, because I use it in my own personal life and space, and being able to work in this space, it certainly has enhanced my own well-being. So as we go forward and talk about it, I hope that you can stay engaged with not only being a listener as to how would I use this with students, clinical students or otherwise, but how would I also use this for myself in any kind of area in my life that I might be looking to learn something new or grow in or make changes in. So I think it's applicable. So if we can kind of wear those couple of hats, it might actually make this a little more engaging for yourself and a little more fun to take a look at it. So my objectives, or the learner objectives I'm hoping you come away with today, I'd love for you to be able to understand at least this master adaptive learning model, why I'm even talking about it, where it comes from, what the areas are that are important to know about it, how it fosters adaptive expertise, which is one of those terms that is a buzzword with regard to education of students at higher education level, how we're doing that in health professions education, And the application of a tool that I'm going to give you, or at least share with you, that is a learning journal that students have the opportunity to manage and manipulate in their own learning. We're also going to talk a little bit about batteries. This will make sense as we go through, of motivation, curiosity, resilience, and growth mindset, and how these apply to learning, the professional learning in the clinic. And then how to recognize that academic coaching is different from advising and mentorship. So considering the hat that you're wearing when you are working with students, and when you might need to call in some skills from another one of those hats. So we're going to move to, what is the Master Adaptive Learner model? And here's a picture, but the Master Adaptive Learner framework, it's an educational framework. It's based on this metacognitive approach to learning, which involves thinking about one's thinking. So the minute the students walk in our doors, we start talking with them about the idea that they need to be very thoughtful about how they're going to learn, rather than just die in the, I have to read 100 pages and I don't know what it's too much information and I'm not going to be able to get it all done. We really want to get them to the space where they can think about how they're thinking about reading. So what we want them to do is recognize where they start going off the rails in that, that panic sense in that one example. So awareness and understanding of one's thought process is important. It's intended to leverage, in the long run, it's intended to leverage both efficiency of the clinician as well as their ability to innovate and use that knowledge to do innovative things. So we're going to talk about that flexibility of thinking. And then this model is based on the idea that clinicians should be able to balance both routine expertise that they build as well as adaptive expertise. I'm going to break this framework down a little bit with regard to these gears. They're not easily seen, I don't think, in this particular slide, but I wanted to call your attention to the whole model. You can see this person in the upper left, they've got the gears in their brain in that silhouette. And then more words are in these gears that I'm going to expand upon. You don't have to squint to kind of read those. And then down here at the bottom, you can see that there's this box here that's called a coaching rheostat, and then these little batteries. And we're going to talk about those as we progress. And I'm just going to make sure I'm on the same slide with my notes up above. So here are those gears that were in the brain. Washington University School of Medicine has done a nice job pulling these out and making them clearer, at least for me to see. And so this is what we're going to start in this upper right-hand corner that says planning. This is not going to be anything that probably is startlingly new to you with regard to how do I learn and how do students learn. What is nice, I think, about it is that it's given us this umbrella of organization of thought that we can talk to students so they can talk about how they're doing their learning and thinking. So this planning phase, we say to students or ourselves, like it's myself too, when I'm considering a learning goal on my own, even in my professional life, what is the gap between what it is that I already know and what I want to know or what I need to know? And that's the way that we get them to start looking at the objectives, the course objectives, or the session objectives. Like, why am I here? Like, what is it I need to know when I come away from this? And then how do I empower myself to do that? So we're trying to work on self-efficacy for the students so that they're not sitting as a passive learner in the space, waiting for something to be handed to them. Here's what you're going to learn today. And then just sort of taking that and digesting it, but not owning the material. So this is a method of really helping them own that material. So this next box under planning is the learning. These are actually activities that we ask students to think about. So, okay, if you're telling me what this gap is, you don't know how to do from a physical therapy perspective, goniometry, meaning the measurement of range of motion at the joints, and you want to learn how to do that while you're here at UNE. How do you think you're going to do that? And they're going to be like, well, of course you're going to teach me that. But then the question is, well, what resources do you think that you might have to use to learn that? Yeah, you could come to lab, you could attend the lecture. What else? How are you going to use your peers? How are you going to look up outside information? What might interest you as soon as you start learning about one thing, with other things regarding goniometry? So it's broadening those early conversations so that the student really needs to write down or consider their learning method. Then there's this assessing. I will talk about this a little bit more, gear. And then finally, this adjusting. So assessing is, did I learn what I needed to learn? How do I know? Who's giving me that feedback? Am I giving it to myself? And then this adjusting. Okay, I learned 2/3 of this material. Now I need to learn a little bit more. How am I going to learn the pieces that I might be missing? So again, also you can see here on this right, this coaching rheostat. We'll talk about that and those batteries that are underneath these: curiosity, motivation, mindset, resilience. So here's a bigger picture of that. So interestingly, I did not make up this term rheostat. This is what it is in the in all of the literature with regard to how coaching came in this picture. And to tell you the truth, I started reading this literature, and you'll see later there was a call in physical therapy to step up and start using this model. We had a national it was a piece of literature on excellence, on clinical excellence. And the utilization of the master adaptive learner model was one of those calls to us. So as a clinical educator, I took a look at that and was like, what is this model? How am I going to do it? I don't really get it. And then came across this coaching rheostat. And because I was unclear about how academic coaching was really meant to be employed, that was when I gained a coaching credential, because I thought this is not going to, if we're really being called to use this model and we really are half using it or kind of using it in a way, like I don't think it's going to be as effective as it was originally intended. So we'll talk a little bit more about coaching in this model. And then you can see these batteries a little more clearly here: curiosity, motivation, mindset, and resilience. They make a lot of sense, but then how do we get to these with students, and how are we, seeing them in the classroom? Are we measuring what that looks like for them? And are they accepting of that information? So if we wind back before we got this, before I had this article on excellence in physical therapy education, why are we considering adaptive expertise at this time? And let me just make sure that I'm right on target with my good notes here. So we have, because medical knowledge, the healthcare systems and clinical challenges were changing so fast, particularly in the times first COVID, which really called on people to sort of pivot what they knew and then what they needed to know and how they needed to automatically implement it. But now also in the age of AI and new technologies and evolving best practice, students and practitioners really need to be on that cutting edge of adaptive expertise. So there's several articles here coming out of the physical therapy literature, the medical literature, it's coming out of occupational therapy literature. So with regard to those of us in allied health supportive professions, we know that sometimes the medical literature drives a lot of these changes. And then we sort of determine how that's being used in the medical field and how that affects how we're doing some learning. So the call is out there for adaptive expertise and for the adaptive student. I know that at UNE, our strategic priority 1 group, which is well beyond the physical therapy department, is really looking at adaptive expertise at both the graduate and the undergraduate level. And I'm also doing work with the College of Medicine with regard to some dual grant kinds of work regarding how adaptive expertise is really applied to CBE, so competency-based education. So there's a tie here, and getting used to this language is important and thoughtful as you continue to move forward with something like CBE. So this, I have a couple of graphs just to share so that you can understand sort of the weight of the model, the why of the model, because I think the model feels really nice, but I also want to know what the literature is behind it that gives it some of that meat. So this is the adaptive expertise model. The graph is commonly illustrates how learners move beyond simple efficiency. So you can see down here on the x-axis, you've got learning for efficiency, and this.
Tara, I might be on the wrong slide. Which slide are you on?
Adaptive expertise model. Can you see that one?
I'm scrolling forward. I may have just not kept up with you in the slide changes. So let's see.
Oh, it looks like on my end that I can actually forward the slide. So.
Right.
Okay.
But I just, can you give me a slide? You're on 14. Very good. Oh, interesting. There we go. 14, adaptive expertise model. Yeah. Sorry, folks, we'll share the whole. I realize some of those slides moved pretty quickly there, but we'll share the whole thing when this is done.
Oh, okay.
Go ahead. I'm with you. Just let me know if you're switching slides and I'll try to keep up.
Okay. For clarity, when I'm forwarding the slide, everybody's not seeing that forward?
Correct. Only I can move the slide forward. So just let me know when you want to switch.
Oh, okay. Apologies for that then. So a little bit of that is going to be confusing in the way that I was speaking. So actually, if you would like to go back, if you could go back 1, 2, 3 slides to slide, I don't know what the number is, but it has that coaching rheostat picture on it.
There you go. We got coaching, and then we have the batteries.
Okay, that's going to make more sense, right? So when I was speaking about that, I'm flipping back to see what you see. Okay, that's slide 11. So that was the visual I was giving of this coaching rheostat, talking about how coaching was used, and then of course these batteries. So could you go to 12 for me, just so that I have a sense? And 13 is great. And so on slide 13, all I was speaking about was these articles that you can look back and see. On slide 13, if you, I think it's an active slide. So if you do 1, 2, 3 clicks, you can see all 3 articles from these medical bodies that are speaking about adaptive expertise. Are you with me?
With you.
All right, perfect. Let's move to slide 14 then.
You're all set.
Okay, great. And that means you're also not seeing a cursor. So that's important for me to know. Thank you. So, because I'm pointing at stuff, so that's not helpful. So if we look at this model, this is now the adaptive expertise model. And you can see, again, this x-axis that says learning for efficiency. And then the y-axis is learning for innovation. So it illustrates how learners move beyond simple efficiency or routine expertise towards this adaptability and innovation. So we're really hoping to show that the MAL framework intends to help learners gain not just efficiency, but also adaptive expertise. So that the middle line going up diagonally, learning for adaptability, is the sweet spot and what we're hoping for with regard to students. If you could advance, that's great. Okay, so you should have in front of you now the master adaptive learning curve. Thank you so much. I see one thumb up, and that's actually helpful. So the master adaptive learning curve just really shows that there's slower learning in this master adaptive learning model at the start due to a deeper investment. So this might not feel good for students when they're doing that initial learning, when they want to immediately get knowledge and have a sense of it. And they're like, I don't want to think about my thinking. I just want to know the material. Just give me the material. Just tell me what to do, or put it in that space. And you can see with this blue line that's lower, that line actually responds to the slower learning curve, but ultimately yields the far more desirable results. So you can see the pitch of the angle, how it goes up at the end, showing that adaptive expertise and sustained growth happens with that early investment in that learning versus when you just have routine learning that we've done over time, which is the indicator of that black line, which is steady incremental progress. This is what makes sense to us, but we've got to be able to flex at that end when something new occurs. All right, so I'm going to progress the slide now. We have one last graph, which are the least interesting, but important still. So this is the adaptive expertise versus routine expertise trajectory. So you can see at the bottom things that we're all familiar with. There's a novice learner, how things go with an advanced learner, moving up to competent and proficient and expert. But here is where things change. So we've got an automatic expert, the person in COVID who knew what to do with communicable diseases, et cetera, but then may not have had the mental flexibility or capacity to turn on the dime each time we were asked to turn on the dime, which then muddies waters in bigger spaces in order to determine, are we going left? Are we going right? What are we doing as a profession? And what do I know already as an expert? But how can I now mold this new information? And especially, as we said, in the age of AI, when information is just exponentially starting to flow, how am I going to take what I know as an expert and determine that this is, that I'm going to innovate here? Like, is this wise space to innovate in? So this is the kind of thinker that we're really striving for with this model. All right, I'm going to move forward again. We got some gears in the head with this next move. If we're on slide 17. So these again are there, and you might have missed when I was talking about this earlier. So I've reviewed it throughout the slideshow. Hopefully you'll see it. You can see the structure of this planning, learning, assessing, adjusting that we're talking about over and over and over again. It's great while it stays in someone's mind, but how does that make a lot of sense on paper. So we're going to move forward. If we move this next slide forward, you will see that just one slide, so slide 18. The slide is entitled The Learning Journal as a Tool. So what I've done on this slide for you is, and I will show you on the next slide what it looks like. So I've included a live link so that you could have the opportunity to go to this link. This is an example of a learning journal that we're using right now at the University of New England. It's live for us in terms of the fact that we're using it as an example and we change things back and forth. You're definitely welcome to join it. If you cannot see it, if I needed to share it in a different way, I will definitely do that for you. And I got a thumbs up. That's great. So on my next
on the chat as well.
Perfect.
That
Thank
link
you
is
so
live in
much.
the chat.
Okay, great. So you should have a chance to look at that. We're going to go to the next slide. That's also going to be the learning journal so that I can talk about it a little bit. And I'm going to move it on mine above and actually make it bigger for me to see. That's the blessing of having my own overhead. So if you take a look at this, you can see the top box in the blue boxes. We've got this planning phase, learning activity, assessing phase, and adjusting. You should recognize those terms from those gears in that head that I've been talking about as we've been going through. So this is the one of the suggestions of how to utilize this model. So with our physical therapy students, you can see if you look all the way to the left under learning objectives and skills, and we look under the box that's labeled number 2, for the students evaluating vital signs, this was one of their objectives that they had for whatever the course that they were in. This, okay, and I can see that you'll need a copy, and I'll get that to you for sure. Hopefully you can see this just right now for a reference on the slide in front of you, and then happy to get you a link for this. But if you look under this number 2, if you can read it, if it's big enough, under learning objectives and skills, the column all the way to the left, it says evaluate vital sign findings to determine it's safe to initiate physical therapy care and the need for referral for another healthcare provider. So we want them to evaluate their vitals. The question is, how are they going to do that? And if they're coming in cold and they've not done any of this information, we're going to ask them to try and write a learning goal in order to keep them active in the process of doing the learning. Rather than handing them the techniques that they're going to have, which eventually they will have, we're going to ask them to think about their thinking. How do you think you're going to do this? So the SMART goal format, which we'll relook at in a moment, this is just a student example. I will accurately conduct, so now I've moved on to column B under that planning phase. The student writes this. I will accurately conduct a vital sign assessment on a deconditioned patient during a simulated mock exam in less than 2 minutes. Chances are they have worked on their SMART goal writing before they actually write that goal. It's a very well-written goal, and students typically when they're walking in the door have either forgotten how to write SMART goals or never knew really in the first place how to get those measurable things. And I think that we'll see for ourselves too that we forget those measurable aspects of how to make a goal more powerful. But as an example, you can see under column C, the learning activities the student's going to select in order to learn and meet that planning goal that they've written for themselves. Vital signs lab, they're going to do the practice assignment. They've got a flip grid assignment. This is what they're going to do, they think, to practice this activity. And then under D, this is the assessing phase. What we know about ourselves as humans, not just as students, is we are actually notoriously poor at self-assessment. So the literature will show us that we do a far worse job than we actually imagine that we're doing when we imagine our own selves. So in the assessing phase, we call this the informed self-assessment phase, so that the student contributes their self-assessment on whatever the skill is. This could be, right now we're talking about a narrow skill. When we send them out into the clinical world, we use the CPI, what's called the clinical performance instrument. They score themselves on that tool, and the PT that they're working with, their clinical instructor, scores them also on the tool. And one of the things we like to do is have them compare their scores back and forth, because sometimes the student is poorly informed about how they are doing. They think they're doing excellent and they are not, or they think they're doing terrible and they are not. So this self-assessment phase, the assessing phase, is important. So in this particular example that we've used, and it's a little bit hard to read, but you can see the student got a 9 out of 10 on their skills check rubric for vital sign assessment. And then they also received instructor feedback that the flow that they did was a bit disorganized. So there's their assessment. So now they have the opportunity to move into adjusting. How am I going to fix this? Right? Your automatic brain says, I'm going to try again. But yeah, how are you going to try again? So in that adjusting phase, they get to think about their thinking around how they're going to redo this, and then how they're going to finally get to that end goal of what it is that they need to do. So this is just an example of a learning journal that students can use. We're progressing and piloting our ways through this, and how students can make it personalized for them, how they can use it to use in all of their content expertise that they're learning, and how it's tiresome. It requires that, when we look at that low level curve in that graph that we were looking at before, it's tiresome at the beginning, but then as they continue to move through, we've seen students, by the time that they get to their third clinical experience, they're so good at reflecting on themselves as a learner, as well as their own sort of self-sovereignty over their emotional regulation and management in those learning situations, that they actually end up moving faster. So I wish I had objective data in front of me for you. I have subjective data and historical, qualitative kinds of stories. I do not have any numbers to yet share today. So if we could move to the next slide as a reminder of SMART goals. So what I'm going to ask you to do right now is a goal setting activity, which is going to seem like very either A, punitive, or B, unnecessary, but I'd really like you to think about it in order to engage. So if we recall, a learning goal, any kind of goal, a patient goal, when we're writing goals in their record and we're planning their plan of care, the goal is specific, it's measurable, it's attainable, it's relevant, and it's time-based. So I'm going to ask to advance to the next slide that has the learning objectives for today that I flashed up earlier. And I'm going to ask you to take this time to write a goal, a SMART goal, about what you would like to take away from this presentation by the end of the time together, and see if you can just generate for yourself the measurable, right? All of the elements of that SMART goal. So I put the objectives up there. What it took away was the SMART elements. But those SMART elements, again, are specific, measurable, attainable, relevant, and time-based. So just to re-grease your wheels for goal writing, and you can put that in the chat. Taking away anything from these objectives. Really, the practice is about the goal writing. And I think we'll give just 1 minute for this activity.
So Tara, just to confirm, you would like us to write down our personal goal, not one of these goals. Like, what do I want to try and get, a specific thing I want to figure out in the next 15 minutes?
Yes.
Okay.
Just for the point of it, just for the point of activity, even if you're like, I really don't care about any of this, we'd like you to care about some of it. There might be something that piques your interest. And I'll give you just a few more seconds. I'm not going to police everyone's goals. But the point of the activity is to re-remind ourselves, because we are practitioners and we do this all of the time, but we are likely not doing it in some areas of our lives that we actually could be applying it. And when I do coaching, health and wellness coaching and or well-being coaching with folks, there are all kinds of areas that they are really looking to address in their lives. And sometimes writing a SMART goal around those feels like it's just so ethereal that they actually can't come to that place to do it. But once they've done it a couple of times, it's really empowering. So the idea is to empower change in a way that a person thinks is manageable. So I think this is great. Thank you so much for the goal that's in there. And any others, please feel free to trickle those in if you have the opportunity to do that. So we're going to move forward and just talk a little bit about these batteries. And then we'll have an opportunity for some questions just so that you have a sense of where we're at. So I'm looking at slide number, just to be sure, slide number 23. And I might speed through these a little bit more than I might have looking at the time that we have. I want to be sensitive about your time. But curiosity was the first battery that we were talking about in that battery set. And what I wanted to mention that is important about curiosity has to do with psychological safety. So the student or any person needs to feel as if they have a sense of psychological safety in order to ask questions. The student that is not asking questions in the clinic is a student who doesn't feel like they can for whatever reason. We don't want to relegate and think they don't have any questions. They're just not naturally curious. And that may be true, but we're really hoping that that we can work on the idea of psychological safety. I don't want to look stupid. I feel as if I ask a question, it's going to define what I already don't know. There's so many elements of psychological safety that can be built up in learning space, not only for us here before students get into the clinic, but once they're in that clinical learning space, and this is in any field. So curiosity is important to have a focus around. The next space, I'm going to move on to the next slide, which is number 24. This is the next battery of motivation. And motivation is a critical driver. You can see an iceberg there. So the idea behind that is that we all have both intrinsic and extrinsic motivators. Extrinsic motivators for students are their grades, what other people think about them in class, the prestige of the role that they get when they graduate, and probably their paycheck, right? Those are those extrinsic motivators. And then the powerful motivators underneath are the intrinsic motivators that are mostly about their purpose, their meaning, their mastery, the things that are really the things that for us in physical therapy, I will say to them, this is what you wrote about in your admissions essay. This is why you decided you wanted to be a physical therapist. You wanted to have this kind of relationship with your patients or work on these things. So tapping into that intrinsic motivation of the learner, maybe looking at their values, is a powerful tool in order to get them to focus their own emotional sovereignty so they can get back to those learning gears. So if we can move to the next one, I just want to make sure, and I could and have given workshops on each one of these. So this is really, really covering a lot of material in a taste test sort of way. But I just wanted to make sure, I'm happy to do any expansion with anyone on any of these points if there's any point of interest that you might want to sort of expand upon in your clinic and in your space. Growth and fixed mindset. This is the work of Carol Dweck. A lot of people are probably familiar with these terms. What does it mean to have growth and fixed mindset? And I actually had some examples to ask you, to sort of do an interactive question. I don't think we're going to have time to do those pieces, but students who say things like, I've always been terrible at understanding lab values. I've never been good with numbers. Each time I practice presenting to a patient, I feel more organized. I don't have all the answers on rounds. Maybe it means I'm not cut out for this field. We as educators need to have our ears tuned in to what kind of statement is the student making? And is that a growth statement or is it a fixed statement? And do they even know? And so sometimes this is a way we can give them objective feedback without saying, don't be so negative, or those might be our feelings, like you're blocking your own learning because there's negativity. By knowing the growth fixed mindset dimensions of things, we can have a better conversation with our students about learning, and then we can kind of help them steer into another direction so that they are feeling more confident. So let me just go to this last one, which is resilience. There's two more important points I think that I want to make. So in resilience is actually my co-DCE is working with me, Director of Clinical Education. We're teaching actually a mini faculty workshop on resilience, both for the faculty themselves and then how they apply that to students. There are many, many techniques that you can use to enhance student resilience, which is something that we just talk about all of the time, where the student just doesn't seem to have the self-efficacy. Again, as a taste test, I would be happy to elaborate, but we use the VIA character strengths which the student then does a strengths assessment on themselves. It's more than what a traditional Clifton strengths assessment is. This is about their own personal value set. And there's also a nice tool that we can share with them that's objective, that helps them determine if they're overutilizing or underutilizing what they're already strong in. So the language of having a conversation with a student about whether or not they're doing that work, they're over or underutilizing strengths, seems like a really friendly approach versus looking at, let's look at your strengths and weaknesses and see where you need to kind of, build up on that side, right? So it's a different approach. There are several approaches that we can do. And I've mentioned here this self-compassion work by Dr. Kristen Neff, another piece that is evidence-based that talks about how we can clear up and build resilience in students and ourselves. So this is also helpful for ourselves, and I do this for myself. So if we can go to this next slide, and I'm going to make this actually my last point of discussion because I can see that I'm running a little long. And then the following slides after this are actually going to be some suggestive coaching techniques that you can use. And I'm happy to come back again another time and talk about coaching techniques. You'll have the slides, a type of question. But right here, I wanted to just point out there are differences between advising, mentorship, and coaching. And coaching does have some very specific competencies built around it. The ICF coaching group is the gold standard for coaching. They have a whole lot of competencies that you have to pass. I actually am board certified through the National Health and Wellness and Wellbeing Coaching, which was AMA supported. So there are some fields where coaching is not just willy-nilly, where I'm like, I'm coaching the student, and I'm just wearing other hats. So you can see here on this slide that there are different focuses of each of those things. And I'm just going to share with you this primary focus. If we can look at that column on the left, or at least that title on the left, and then go across in that row. So the primary focus of academic advising is for course selection, requirements, policies, progression. Do you need remediation? What are we going to do about your grades? Mentorship is much more personal. It's career development. How can I help guide you? How can I help role model for you? How can I network for you? What kind of long-term guidance and assistance can I give you? How can I share my experience with you? Coaching is not that. Coaching takes those hats off and is all about the questions that you ask the student in order to get them to think about their learning, their places that they need help with, and how they might approach the task for doing some of those more positive learning aspects. So it's growth through reflection, self-discovery, and goal attainment. So on the next 3 slides that you'll get to keep, that I'm not going to go over for time purposes, there are 3 different techniques that I had shared with you that you could use that are coaching techniques. One of those is appreciative inquiry. How do I ask great questions that are open-ended questions? I gave you 3 examples of good appreciative inquiry questions. We do this with patients already, motivational interviewing. How do we leave a student feeling motivated in their learning? So a question might be a scaled question, like, how confident do you feel that you did with this, goniometry activity on a scale of 1 to 10? And they might give you a 5. And you say, 5, that's great. Why do you feel so confident about that 5? You're not asking them why it's not 10. You're asking them why they feel great about 5. And they can say, oh, because at least I knew how to do blah, 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 or at least I understood this part of that. So you're leaving them in that space of, oh, okay, we're talking about how well you did in this activity. And it's fine that we can build up to the pieces that you're missing, but you know that you're already strong. So we're gonna rein that in and work on that. And then the final skill that I included in the slide deck that you will get is growth mindset principles questions. As I talked, as we had gone back, how do we determine whether or not what the student is saying, as we're the detectives of their voice, whether or not it was growth or fixed? So I want to wrap up with that. I have some slides of references, but I want to give an opportunity for any questions if there are any, and I apologize for running that little bit long.
I invite everybody to turn your cameras back on. I want to make sure those references did come across the screen at the end. There you go. But as she said, we will get that out. Annie, I see your hand is up.
Thank you. Thank you so much for spending your time with us today and for your presentation. I'm trying to think about how I want to phrase my question. I probably should have waited until I had it better well formulated. So I don't want to sound antagonistic in any way because I am supportive of everything that you presented today, but this is just something that has been kicking around in my mind for a while. So what outcomes are we actually trying to affect here, I guess, is part of my question. Are students not learning what they need to learn? Are we trying to affect their psychological well-being? What outcomes are we really trying to shift here, I guess, with the introduction of like the master adaptive learner and with these, coaching techniques and interacting with students in a different way? Like, what is it that we are trying to shift? What metrics are we trying to shift that we're not meeting the benchmarks prior? And what data do we have to suggest that these interventions and framework shifts are helping us then meet those metrics, I guess? And again, I don't want to sound antagonistic because I am in support of creating a quality clinical learning environment for our learners. But this has been like bouncing around in my mind for a while. Like, what is it that we are up to here exactly?
Yeah, I appreciate that question. And I thank you for asking it. I did in the references, there are a slew of references that will be able to answer the question a little bit better. But from our experience, at least those of us who are educating at this level before we're sending students out into the field, we're recognizing that the student does not have the skill set that they used to have in both ways, in both their cognitive aspect of thinking, as well as their social and emotional coping skills. So the student we used to be sending you from our programs, but just as a field, are no longer looking the same, and it's across the board. So it's not, it's with graduate, undergraduate medical education, it's everywhere. And so the model does have evidence behind it that the techniques that we're talking about in terms of each one of the techniques I gave you, for example, under resilience, has its own set of has its own set of data about increasing resilience. What I couldn't tie together for you today is, self-compassion is shown to increase medical student growth, those kinds of things. I don't have that tie. What I do have is that coaching is something that has increased the responsiveness of medical students in their learning. So that evidence exists. So in a presentation like this, it's really hard to capture all of that. In the references that I gave you, and certainly I'm waving this book right now, right? I have this big Master Adaptive Learner book, but then I've also got the Coaching in Med Ed book, like all of the ones that have the evidence that supports why the model is useful. And I don't know that it answers a lot, and I understand your question and the question would also be, are we just going to jump on the bandwagon of every novel model that comes along? And I get that, like I really get that. What we have seen in sort of piloting this space is, like I said, by the time our students are on their third rotation and we've done some of this preemptive work with how their emotional literacy is, the education on emotional literacy, they can then express their frustration in their own learning process a lot better than when they entered our doors. So again, subjective, but has been more successful, and certainly in guiding the student that is the difficult student that we end up, that could be on the brink of failure or could be failing a clinical experience. But overall, the breadth of the group seems to be more resilient and more receptive to feedback than I've ever seen them once they've done this kind of approach.
Thank you. I appreciate that. And I probably should have qualified all of that to say I am a psychologist, so I'm all for emotional literacy. I truly am. I just am curious about, what is it that we are really up to? I don't know if it feels like it has been truly articulated for me to really realize the vision. So it's just something I've been curious about. So I appreciate your answer. Thank you.
Yeah, you're welcome.
I'll toss a question in there. I'm thinking about our preceptors in a rural setting who are precepting residents. And they might only see their learner for a very limited time, 2 weeks, 4 weeks, and that's the extent of their relationship with it. I'm thinking about that chart you showed where doing this framework is a little slow to start, but then it shoots up. But my question is that time sensitive? Meaning, like, if you only have limited time, is it worth going through that process? If you only have 4 weeks total, does it require you to be with someone longitudinally for a year for that to have impact? Or do you feel like there's a way to really use this model in a short amount of time?
So I think that it depends on how well we're operating together as a team, to be honest. I think the learning curve of writing a goal and thinking about your thinking should oftentimes be happening at our end a little bit. By the time, I would love them to be familiar enough with a learning journal format. If they came to you for a 2-week clinical rotation, that they would know that they had the learning objectives that were on the left and they were ready to put to, sort of the wheels on the ground to how am I going to learn when I get into your setting. It would also be, I mean, it's a little bit of the reverse and onus on the setting to say, here's the things that you can learn while you're here, and here's how you can learn them. I will show you, we will demonstrate, we can do this, we can do that, here's the chart, right? And then the student can then take some impetus to write those goals. So I think that, we're talking systematically that the language we would need to be on our end, preparing them to be ready to do this work, and on your end, ready to receive it. And then I think a 2-week would actually be completely fitting, and they should be able to master that.
Thank you. I appreciate that.
You're welcome.
Any last questions, folks? Well, Tara, thank you. Thank you for a great presentation. Thank you to the Building Maine Network for putting us in touch with Tara. What a great opportunity for all of us. I'll simply share that next month we are coming together again in October for Dr. Monica Tim is going to be joining us, and her presentation is writing impactful skill-based assessments without bias. So thinking about how we assess our learners in the most powerful way possible. It's a lot to unpack just in that one phrase. So we do hope you'll be able to join us next month. As always, the iHELP-Maine Learning Platform is a resource for folks, and that's where we post all of these recordings now. They're all going to be found on the iHELP-Maine Learning Platform, which can be accessed through the Merge Collaborative's website or the Building Maine Network's website. So thank you all, and we'll get you that presentation and the notes. All right.
Thank you.